5, well, actually, one year we had 7 tables, I think, that Samaritan provided. So uh, that was part of what I emailed to them. It's not like they haven't been involved. And it is a wide assortment of their services that we provide, and we've actually had hands-on services at a couple of the events. Um, I have to be careful and remind myself that we did just pass through what 3 years of COVID related, stuff. So even our event was kind of odd. So it may be time to sit down with folks and try to see what we can do collaboratively. I certainly have nothing, like I say, against it. And we could do a longer event and separate it out. There are a number of ideas, but I just wanted to let this group be aware that other people are thinking they want to talking about, and it's 2 groups that we already deal with. So, Larry, you may bump into somebody at the school that may say something to you, and I certainly don't want to say no. Um, the the med school will do one in May. I can't remember what the name of it is. It's different than the last time, but they routinely do an event. And again, for the last 3 years, it's been virtual. So they have breakout rooms and all this, be completely different face to face. So, and I volunteered to help them with that. I'm fine. So just to make you aware. Thank you.
I'd be interested in coming and talking to us about what they're planning and coordinate with that.
Each one of them, when I volunteered, we might talk about it. They asked to put it off at least a year, but I'll push. Even if it's a year from now, we might be able to sit down and talk to them. We can remind them what we've been doing, and like for instance, the IHN people are basically the Medicaid, the insurance part of Samaritan, and who we deal with has been the larger Samaritan group. Although the folks that come to visit us are the Medicaid group. So it might be appropriate to find somebody at the IHN level to come and chat with us. But I'll double check.
I've had a conversation about expanding our health fair.
Yep.
This might be enough.
Yeah.
There's interest, but sounds like we have students work surveys and coming into the high school, and we have a liaison and everything. There's must be some kind of communication problem. Lots of ideas, but no process for that.
Well, it also occurred to me, particularly from the students' perspective, for a long time, they didn't have a large enough venue to pull anything off. I went to one that they had in their lobby, and it was crowded. It was informative, and they were just kind of introducing themselves to the community. I think the mental health advisory board I'm on, people were there representing themselves, but it was clumsy. But now they have that whole building in downtown Lebanon. There's a huge venue possibility there. They've just grown, so I could see them feel like we can do this, So, like I say, I'm okay with it, and I think all of us would encourage them. It's just, don't pick the third Saturday in August.
Used to have, remember Dr. Monsanto brought the medical bag to
Yep.
kindergarten, and they had this great event, and that was pre-COVID too.
Yep.
And so are they wanting just to really engage?
Like, again, I was remembering that too, and many of the people that were involved are not there anymore. So their memory of this stuff. The students change every couple of years, so it's a short-term memory there anyway. The folks that we're used to working with at the administrative level have changed. That's true in IHN too, and that's another thing that's happened. They've got some real go-getters at IHN now. So they're wanting to push their message, and that's fine too. And really, for some people, it's news that any of this other stuff has been going on. That's kind of sad, I think, but, you know, so thanks for the time.
There is a person, I gotta look it up here.
She's at Western.
And I tried to get a hold of her today.
And what was
Jeannie.
her last name?
Um,
Is it Davis? She's kind of an outreach person.
yeah,
Okay,
once we talked about to her the other day, Jeannie Davis.
oh, good.
Okay.
Yeah,
She actually graduated from Lebanon High School and has lived in the community forever. Yeah.
Yeah.
And she spoke at Rotary she was the program. And she went through a numerous amount of programs that they're doing in Lebanon, which was very nice. But so many of those same programs we're doing here, and they're not having anything, they haven't interfaced with us at all. And so we're starting that conversation with her to see if maybe she can start. Apparently, they're doing some things. They are doing some work at the elementary schools and doing some programs. But yeah, I think she would be very much interested in trying to coordinate.
but we're ahead of the game
Well, that's it.
here.
They're not aware of what we're doing. No, and it was program after program after program. And
If the students are wanting to do something,
Right.
If I were her, I wouldn't tone it down either. So this is a kind of collaborative discussion. I think we probably
I
need.
believe she said that all of the students have to do 30 hours of volunteer.
Right.
Yes, it was
And-
30 hours.
And so that's pretty significant. If there's 100 students per class, and
Right.
there are what, 4 or 5 classes? So they must have 600-700 students that have to volunteer. So I think it's a really good resource that we need to tap into, and we need to invite her.
I'll reconfirm with her. We talked about it tonight. We'll see what
I
happens.
called her the last couple days to invite her to come, and I invited her that day and then sent her a text.
Yeah,
So,
I'll try my magic too.
All right.
right.
Well, it sounds like you have a good,
She's open to coming next month.
Yeah,
If we want to do that.
yeah, she's pretty open about it,
So
either virtual
I
or
think this
otherwise.
is a very soon meeting.
yeah,
Pretty impressive lady.
sounded like a lot of really good programs that she is coordinating, I guess would be the right
it
word.
just so happens that in Sweet Home, we've been doing a lot of those programs on our own because they weren't happening here. So we've been trying to do all that stuff here, which is good because it hadn't been happening.
Mm.
So,
So Dick, you and Bob had been talking about doing some kind of workshops and classes. I talked to Rhonda Cannon recently, and she's just plugged into a group that does parenting classes in Albany. You're probably aware of them, and they provide a meal. And she said the meeting that she went into, the first one, there was 100 people there, and that they're doing this in Sweet Home now. And she's going to somebody's going to come to our next meeting
Okay.
and talk as well. But I thought to maybe introduce that to more community members, maybe that's something you and Bob could look at and look, and he knows Rhonda, so it might look out that way to do something. I think that's something you seriously need. So,
Good.
all right, anything else? Okay. So Western University, since we've already kind of
Well, we've already touched on it. The lady, Dr. Davis, did an excellent job at Rotary talking about different programs from Western. And it sounded like numerous amounts of programs that were good. A lot of kid programs, which I was impressed with. The students themselves that did the focus groups, I have not heard back anything from them. I think they're probably still gathering information and trying to draft up what they want to present to us. So hopefully within the next month or two, they'll have something available.
That's what I was really was wondering about is we're looking at 1 or 2 months. I think
Yeah,
that's-
probably next month. It sounds like we have quite a few people coming, so maybe the month after that would be good if they're ready by then.
All right, and that brings us to homeless.
Well, I have honestly not heard a whole lot since they opened up. It's my understanding that there are 21 or 22 clients there. I know that some of the clients were people that said they would not be going into it. Regardless, they were never going to go there, and they're there, and they're functioning very, very well, from what I understand. It'd be interesting to hear from the city as to, what they've been hearing as to, we've been open now for what, 2 weeks,
3.
3? I don't know. That's good.
Sean had said that there was another person from Sweet Home that got a hut today. And he was excited about that because she didn't think she deserved a hut, but she got one. And he said that if you don't think this is working, walk around and talk to the business people around town and the people that were around the
Old
area,
City Hall.
old city hall and the library and those places. And he said that they all say that not only do they feel safer, but everything is going much better. And so he said, by his own admission, he said, I would call that a success. And I said, okay.
Been a hard one, but it's, as far as I know, it's working out really well. Kudos.
Go ahead, Kelsey.
I was gonna say, just echoing what everybody's already said, I know that the FAC still is finishing some of their final huts. I think they have 8 left to finish. And they're minor things, and then they'll be able to go to a larger capacity. But we've been hearing everything that's been going pretty well. They're still finishing. They have, another ramp that they need to do up front and things like that, but they're working through all of those pieces. We've had a temporary security company that's there that is now getting traded out, I believe on Monday for the permanent security, and this will be the security that the city went through, going for a process. So it'll be a security that's familiar with this type of demographic of the residents as well. So we're hoping that that goes well. However, security has been going well already. In speaking with the fire district, they have been getting some additional calls over to the FAC, ambulance calls and so forth. But one of the things that's kind of nice too, we've been hearing, is that because it's a managed facility, it's a more centrally located place. And by having Dr. Sam there and having some of the other, Ridgeway Health and some of the other pieces, some of the calls that were happening more frequently, there's more education that's also able to occur with the residents, and everybody's anxiety has really, really decreased. So it's better for the residents. We're hearing very positive things from some of the business owners in the area. And we go through, we were cleaning up the trees by the library today, and the whole area is just much nicer. It's a very different view, and we want to explore, freshening that area even more. So that's something that the city's looking into right now. So I would say, I mean, from the city's perspective, we also consider this to be a success. The amount of time that we're having to spend on this has greatly decreased.
Excellent.
Christy joined us. Do you want to introduce yourself? Because we're being recorded.
I'm Christy Walker. And basically, but for that thing, and help Claire.
Mm-hmm.
I usually have those supplies, and Jen does backpacks with supplies, so it's a great opportunity to get people to see the resources that are there. Oh, and get their school clothes and get their backpacks and school. So it's nice that we can collaborate and do it at the same time.
I have a question. Have you gotten new numbers on the homeless numbers for?
For about 140, which is kind of on the low end for us. I think it was up to 240, so 100 less. I don't know if that's accurate yet. We usually have a big influx right around spring break. It's identification of these students is the issue, not that they're not there. Process of identifying. And a lot of times families want to, hey, we're home. Our homeless students are not the same as guys living in the hut.
Right.
The students are what they would call doubled up, or living with other families. So, do have a few. Some vehicles, but for the most part, covered. I do have a student. Yeah, so that he's been a hard one for us. Sure. I don't know, what is going on with the downtown? I haven't seen those.
They're in front of you. Kelsey, the battery's in front.
There you go.
Am I on? I'm on.
You're on.
So we have passed a couple of ordinances here in town recently, one where RVs are not able to, people aren't able to camp in their RVs on the streets. And as you've probably noticed, we've had quite a buildup of that over the last year or so. So they can park on Long Street and then on Main Street for a couple of hours, but there's no overnight camping. And so with that new ordinance, people have, I don't know where they've gone. They've kind of moved out of the area. I heard that they went to the east end of town, out at the scale shacks, but I drove out there today to check it out and there was nobody out there. So I drove all over town. I can't find where they went. So anyway, so there's that. And then as far as people who are camping in cars, and I think I know the person that you're talking about in the van, they can no longer camp on the streets, but they do have the ability to camp in the police department parking lot, and just have to move on in the mornings. So there is a spot for them, and it's safe there at the police department in the parking lot. So yeah, there's
Haven't seen them.
yeah they're
Kind of worried, thinking, where are they?
yeah. I don't know where the RVs and motorhomes have gone. Honestly, I don't know. So
And I think I only have one or two other children.
Okay.
But I know that she's been foster care, so. Say good place. That's, and I've been looking for him, but I can't find him. I thought, where are they go?
I think I know where they're at.
Okay,
So,
good. All right. And he's been going to school, so, you know,
Oh, good.
I'm happy about that.
Yeah.
So,
Well, the solution of having the place at the police station with the bathroom there, and it is so much safer.
Yeah.
And it is from my perspective as community member, it has been highly successful because people should be able to be safe. And so,
On another note, a week ago, the Rotary Club and FAC honored all of the high school students that helped build the huts. The kids spent pretty much a year in building the 30 huts. And so FAC and Rotary wanted to thank them. And so we had a little celebration, and most of you were there, and I appreciated that. I think that the kids appreciated it. I had quite a few of them come up and thank me after it was over. And in fact, one of the kids, as I was driving through Taco Bell that night to pick up something, he goes, "Oh, you're the homeless guy, aren't you?" I said, "Yep, that was me."
Oh, that's what we call him now.
So now on, my nickname's Mr. Homeless. Yeah, not Mr. Horton, it's Mr. Homeless.
We've kind of changed. It's the homeless dude.
But the kids all received a handwritten thank you and a little gift card from some of our local merchants. The instructor received a handwritten thank you and a very nice donation from the Point for he and his family to go up and have dinner there. So overall, it went really well. I haven't read the paper, but I understand that it's front page in today's paper. So
Lower flat.
yeah, well, whatever. Anyway, I'll read it tonight. But I was just very grateful. The community members that I approached for donations were very grateful. They were all, oh yeah, we'll give to this. Thank you. The kids did fantastic. And I think it's important for the kids to know, and I think I made it fairly obvious to them that everyone in the community appreciates what they did. Not everyone necessarily likes what we've done, but it's far better than what it was. Yes. Yeah, exactly. Well, it's something that to me, the kids will be able to down the road say, we helped build that place. And this is our community, and we want it to be the best it can be.
Well, it's a win-win the way it is.
It's a win-win-win for everybody. The kids learn skills that they can now use in marketing themselves and to employers. And I know the instructor was extremely pleased with the program and what the kids were able to learn through the process. The high school principal was just excellent through the whole thing. He was very supportive, and this is the best thing. I was raised in poverty, and it's nice that the kids are getting in. So many of our kids are in that, and they could be in that. Maybe this will help them not get there. Yeah, exactly. So Dick and I were saying as we walked in today, let's hope this first year and the rest of the whole time goes very smoothly. The startup, I think, has been, yes, it took us a long time to get it done, but it's open. It's not quite done yet. It will be. And it's doing what I think all of us kind of thought it would do. And I'm really glad to hear from the police department that it's going smooth from your end of it too, because that was, you start putting a lot of people together and then they all have their own little issues, in a different way though, a much different way. But I know Sean and Brock both told me individual stories about some of the clients that we have dealt with for years that are now behaving in a more appropriate manner. And I know one of the one of the people actually said, thank you, I was lost. So one person, and from what I hear from Sean, has got a job, and there are a lot of positive that are going on that we thought they would, but it's nice. There's something validating about what has happened so far. And I just pray every night that it continues.
I was at a meeting and for the first time I heard, this is the region meeting. And the first time I heard someone say, well, we should be able to do it. Sweet Home did it.
Oh yeah, Sweet Home do it. Anyone can do it, right? Yeah.
Uh,
Well, then do it.
yeah, they got a thumbs up, but yeah, you can take it both ways.
Yeah,
It's
please
good,
go
good
do
for
it.
us. Good for you.
Good for us.
Well, Larry and I were gonna go back down and fix the rest of the doors down there, but we got told that we made too much noise and caused a ruckus, so
I think there's 5 huts that need doors.
yeah.
And Jim and I put 3 doors on in 2 hours, and we said, we can just go finish that. And Brock says, could you hold off a little bit? Some of the clients got a little upset with you guys being there. Us? I think it was the newspaper
It was the
reporters
newspaper
that
reporters they
was
had there that
causing the issues, not us. You want these finished or not?
we kind of look like homeless people, so we got scruff and we
Yeah, it
got
didn't
we
take
were
a whole
wearing
lot.
old clothes.
Any rate, it's at a point where one good session with 4 or 5 people, when we could have
For
them
a
all
couple
over.
hours, you can have them all done.
But Brock, for some reason, right now he's, I guess, wanting to make sure everything's calm. So
When he and I discussed that, it was sort of an idea of just letting everything settle a
Yeah,
little bit
that's-
and then deciding if it would make sense to have another one or if it would be something that they would just try to take care of in-house.
When I say a work day, I'm talking about 2 or 3 of us that know what we're doing, go in and do it.
I think would be wonderful. So I hope to actually visit FAC tomorrow and kind of get an update on where things are at.
I plan on doing that also.
So we'll
I
see.
haven't heard anything for a week, and I'm like the mother that was watching the hens,
I
the
keep
little
driving
children.
down there and looking and making sure everything's
Well,
looks good, and it all
I'll-
looks good. So
I can also say that 20 blankets were donated from the blanket drive that Rotary is sponsoring right now. There were 20 blankets that I dropped off after Tuesday's meeting. My guess is there'll be another 20, hopefully this next week. Yeah, I don't know who donated them, just different people in the community, which is great. That's what I was hoping would happen. That I know I'm sure all of us have had calls from people saying, what can we do to help? Well, this is a good way to help. Make some curtains. We're after 30 sets of curtains. So there's some work. 2 feet by 3 feet.
I told you, with a 3-inch pocket.
Is that for the rod? Is that what you mean by when you say a 3-inch pocket?
Mhm.
Yeah.
Lisa was actually a seamstress at
Well,
Jansen.
I think the sewing group at the senior center would help if we asked them to. I know they helped. We ended up making 4,000 masks when that was going on, and that was a lot of the seniors that did that. So
Yeah, we didn't do that many. Made about
yeah,
So,
I'm sure you did a
all
lot.
right.
3,000.
Any other discussion on this? So seeing these reports, we probably have no other old business. But we're kind of waiting for the med students to come back with their survey information compiled before we set some goals for moving forward. Because we've kind of come to a point that we need to add back some things. And so I'd ask this group to, if you can think of something that this community needs that's not being met, that has to do with health and well-being, that we can discuss it now, or we can compile a list and discuss it next week or when they bring the survey? Is there anything off the top of your head that should come to that list?
Well, I think we've talked about, you know, in all those meetings, we talked about a lot of different things and a lot of it had to, you know, was centered around mental health. And, you know, I think that some of it was getting the schools more involved in how we, are able to do mental health in Sweet Home, because it's, you know, it goes from here up and there down. So, we talked about how, you know, how that works and I think,
They do not have services. Just not.
I think across the board.
The surveys, the focus groups, I think that's going to be one of the major things that comes out of that. I mean, I sat in on all of them, and that was the predominant.
like I say, that's what I heard.
Kids' mental health, adults' mental health. It's just mental health, period. Yeah, all of them.
Well, and again, it's not just from
It's
like a high school kid. It's
all the way
down
down.
lower.
Yeah. Yeah.
Mhm. But there is money coming available in some of the new bills that came out of Congress that is specifically for mental health.
Yeah.
Well, if Lynn County can't do the stuff, I know that you know, there's other places that are coming in that are, you know, are wanting to get larger. Benton County and some of them that are.
Actually, Lynn County provides a lot of the service for Benton County. That's why you have a Benton County clinic
Yeah.
in Sweet Home. They've collaborated for a long time. I think the county's looking at somewhere around 16, 18 openings all the time.
Yeah.
For the full range of services, not just the kids. And unfortunately, this is nationwide. It isn't just the county. And again, there's a COVID background to this, because when it came time for doing face-to-face therapies, people didn't want to do that anymore. And they're discovering that you can do a lot of stuff over the virtual sphere, and they don't want to come back. So there are providers out there, but they're just doing different provisions. And when you've got somebody in a school system, it doesn't make a lot of sense to take a kid out of class and put them in front of a TV and listen to somebody from Arkansas tell them that they're not doing well. It just doesn't work that way. And that's true of the us old guys too. I mean, I'm just looking
So
at
I heard
somebody who does this for a living too.
when I was listening to this the other day, they were talking about trying to have money out there to entice some of the retirees to come back and
Right.
fill back in those
Maybe contractors.
slots. And that's
Right.
what they had specifically mentioned,
Right.
trying to get them to come back in and do some of those areas until we get people to fill in the
A lot of
slots.
those retired people, right?
There you go.
We got that same thing with referees.
That's right.
For
Right.
the kids' sports.
Right. Yeah, this is gonna get clumsy for a couple of years.
Probably so.
And I'm actually not sure exactly how you beat it. I think you do it from within the community and keep pressing the knowledge that we need help. Most people go into mental health because they really worry about people and they really do want to help. And I'll pretend the mic isn't on, but it would be nice if we could put a little guilt back on folks who are really doing it through the virtual world. And even if they did it 50% of the time, just come in, give us a couple of days, just do it face to face. It would help her a lot. There are crisis workers that are I mean, they're just burned out. Well, we used to hear the problem of burnout with mental health workers all the time. Well, now it really is burnout. I mean, it's gotten beyond the 40 hours plus 20. Now it's 40 hours plus another 30, and it's, it hasn't helped that the state hospital is just basically closed down. There aren't any emergency beds for mental health folks. And I don't mean to ignore the fact that we on purpose joined together mental health and addiction services. So it's actually behavioral health. So you've got all those folks who have, on top of this kind of mental health issue, you've got a drug abuse and those kinds of issues, or vice versa. You've got a drug abuse issue and then mental health things on top of it. And that happens all the way down to the school system and then through the rest of the community. FAC worries about that a lot.
Yeah.
And those are two different specialties in our thinking. This whole behavioral health thing is relatively new in the concept of caring for people. And it takes a skill. And a lot of those folks are just not out there. And I appreciate the fact that somebody's saying that the people are just not out there to provide the service. I take it back. I think they are out there. They're just not providing that kind of service. So I think the farther we go away from COVID, I think
It'll
the
get
better
better.
this will be. But we're going to have to continue to raise the voice. Because what you hear is, oh, we need mental health service. We need all this mental health service. And it's usually the person in the back of the room. We don't have any people to provide the service.
But again, they're blaming it all on COVID.
Well,
And we had a mental health crisis before we had COVID
It was already there and COVID just.
exacerbated.
knocked it out of the park. Yeah.
Yeah.
Yeah, that's my, yeah.
But
But it's different because it's the same people who used to say, and we're all sitting at a table, we said it, it's a mental health issue. And then we got clobbered for 3 years. Now there's a mental health issue, but there's a mental health provider issue. And we got to get those people back in and then build from that. We just took a massive hit. And it's other parts of the community as well. But.
Yeah.
So there are a couple agencies I've been talking to, and this is not a permanent solution. And I don't even know if it's something that this committee would want to pursue. I was going to actually talk with the schools a little bit to see, try to talk to Terry to see if he was interested. But there's a couple agencies that are providing training for teachers and students and things, or it wouldn't be for in-depth behavioral health support, but it could be for some preliminary conversations, and it would be actual, training that could be provided for the schools. Is this anything that you all would be interested in learning a little bit more about?
I mean, I don't see why, I think it would be good to hear what you have to offer.
They have a whole section in Lynn County that they actually work out of the alcohol and drug program, the prevention group, and they do the suicide prevention stuff, alcohol or
mental
health
health.
first aid and that sort of stuff. And they've actually come in and trained, actually did some of the stuff with the schools. They did first aid with bus drivers and things like that. They're out there and they're willing to do it. The difficulty is when the boss of the school system has to provide a space of time that all these teachers can sit down and do this. So, but I think they're ready.
Okay. They were providing time during in-services now for
Right.
mental health education. Even for the organization I was working with, it was Trauma Informed Oregon could do
Right.
400 attendees virtually for $1,200. It was very reasonably priced. And so I thought that
We currently,
We were
have
always doing
studies of
something.
doing trauma informed care with some
Yeah.
of the certified people right now.
But you're not including the classified as well. Because
Um,
the goal was from the time the kid gets on the bus in
Right.
the morning, that everybody be on the same page.
And I
have the same
think that they
background.
are trying to implement some
Okay.
of that.
Yeah, because all your people that work in the special ed, those and the like
Awesome.
reading class, yeah, the classified folks that are in those.
They have the least education and
Right.
yet have the most contact with kids. And so that was really.
I was talking to somebody today and I said, I think the discussion I hear most of the time is that the teachers are getting paid to not enough. And I said, I agree with that. But I said, I also agree when you're hiring an assistant for $15 an hour to do the same things as a teacher sometimes in those areas that they're not getting paid enough, and that there should be more training that goes along with it. And
But that's not anything I.
That's all.
no, but I was just
Shame
having
on
that.
you.
I was having that discussion today about, it's not only just the training, but it's the money, but it's the training and the other things that go along with it that you have to have in order to provide that service. And we had like a 15-minute discussion on it, and
If I might, just because it brings back what I was talking about before. One of the nice things I've found about these training things is you may go into a school and teach even a couple hundred people, but they go home and they have spouses and they have children. And that training doesn't just stop at the schoolroom. So 2-3 years down the road, you've actually invested this kind of way of treating each other, not just school kids, in your community. So the more we can do it, the better. But you'll find that you'll diminish the amount of time that you actually need to do it. Kids that's in high school, as a mom just learned about it, they go on, they don't even have to go to training. It's part of their life
yeah,
and they just carry it with them. So this is what I was saying. I think if we can just keep bringing it up, we need more folks to come forward and say, yeah, I want to do this. I want to take care of people. I dropped out 3 years ago and, I think I should do this again.
I do believe there is more awareness in the school district, and I do believe that
Yep.
Terry is 100% behind
Yeah,
getting as many people trained for trauma informed practices and
all the available
and
stuff.
suicide prevention is totally on board.
I know there's 2 different mental health first aids. There's one for teenagers,
Youth,
and
veterans.
youth, and
Yeah, they've broadened it even
Yeah.
more. Yeah.
And I'm gonna say, sitting between two teachers with very little insulation, I'm hearing conversations that are in this area almost daily, and that didn't occur 4 years ago. Didn't occur 5 years ago.
But she's-
And I'm very, very impressed with
her
the changes.
room, you can,
Anyway.
the stuff from one room you hear and stuff from another room you hear.
It's good. So, all right, so with that, let's do a quick report around. Do you have anything?
No,
No, I have nothing new to add.
Kelsey, want to add anything?
Not yet. There's a few things that I'd like to bring up in future meetings, but I think we're good today.
Chief?
Nothing here.
Nothing from me.
Seeing no further business before us, I call this meeting adjourned.
Thank you.
Chrissy, it's nice having you here, though. Yeah,
yes.
we'd love to have you every time. All right.